And once again, a very warm welcome to all of our attendees this morning. To start off, always with our tips to continually prevent COVID-19. Yes, it is still real. It is still a pandemic. That is why we are still in various different stages of lockdown. But we realize that you guys are doing your part. You're keeping yourself safe. And those from who we've spoken to over the past few weeks, you've given us some great tips, and you are adhering to not only the current protocol set out in the directives, but taking a stand against your own directives and making sure that you update them and always keep them as foremost within your own toolbox talks that you are currently doing. So thank you very much for doing that. Please don't forget to keep washing your hands regularly with soap and water. If you don't have that available, use an alcohol-based hand sanitizer. And then don't touch your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. In fact, if you are sick, please rather stay at home and get yourself tested. Cover your cough or sneeze with a flexed elbow or a tissue, and then throw the tissue into the bin. Clean and disinfect frequently touched objects and surfaces. This would include not just in our offices, but also in our vehicles, our tools, and things that we are using on site as well. Now, you'll notice there is a change today. We were going to discuss the dangers of hydrobills as we discussed last year. However, we spoke to quite a number in the plumbing industry over the past few weeks, and some questions that arose. Obviously, we are handling them as and when they come in, but really these toolbox talks are designed around what you want to hear. And so our IOPSA's initiative is really to bring you, the plumber on the ground, what you are facing, the dangers, the trials, the risks, the hazards that you are facing every day. And we've had an overwhelming request for this question: who is responsible for health and safety? And we are being asked this question from employees and employers alike. In fact, we've even received some of these questions from their health and safety guys, saying, how do they answer these questions when it arises on site? Yes, it's one thing to say, I'm the safety officer on site and I'm enforcing these rules according to the safety specification or to the OSH Act or to the various regulations. But sometimes you just need to hear it from someone else. However, the law is very, very clear on that. And that is the reason why we've changed the Toolbox Talk topic for today. And by popular demand from you plumbers that have reached out to us over the past few weeks, we are going to discuss who is responsible for health and safety. And so how do we go about identifying who is responsible for the various areas within occupational health and safety? Let's start off with why this question arose. So when we get questions, comments, or suggestions, we don't just go and source information and develop a toolbox talk for you. We try and understand why this is such a need within the industry. So we communicate with you out there as well. We find out from you why you are asking these questions, what situation was brought up that made you ask this question. In fact, we even go as far as to interview some of your employees as well to try and ascertain exactly what the real problem is. You see, the only way to find a solution is to find the root cause of the problem. We don't want to just get rid of the symptoms. We want to get rid of the underlying cause, or get to the underlying cause so as to find a solution for all of us. So this question arose because of four things that we've noticed. And this is pretty generic. It's something that we knew from the outset. But we also just wanted to really ensure that we found the root cause to the problem. Now, people who are asking this question, who is responsible for health and safety, was because an incident happened on site and there was not the correct paperwork in place after the fact. Now, what do we mean by this? Well, a contractor was on site. They had what they felt was necessary in terms of health and safety. They were not told about anything else. And this is what they said. We weren't told that there's a safety specification from the client. In fact, it was never actually sent to us. We had an incident. They audited our file and kicked us off because we were non-compliant. Why was this not raised at the previous audit? Yes, we understand that is a problem. The previous audit should have brought out everything that was not correct in the health and safety file. Now, this incident led to a few accidents. And unfortunately, an individual was injured during this incident. And this accident then meant the taking off of leave, going through to hospital, claiming from compensation, and it basically meant delays on site because the contractor was shut down. The site was then shut down because the Department of Labor wanted to know exactly what was happening. In fact, even the client got involved along with the principal contractor to find out exactly what was happening on site. And obviously, the first thing that happens is penalties. Everybody's now penalized because of the delays, and we start standing around almost now arguing, fighting. Who is actually responsible? And this is where the pointing of fingers starts happening. He said, she said happens. And only then afterward does the actual information come out. Well, you were supposed to have this because it's in this document. Now, if this has ever happened to you, you can understand how frustrating it must be. And it doesn't really matter which part you play in this, whether you're the client, whether you're the principal contractor, whether you're the contractor, whether you're in health and safety, or whether you're the worker on the ground, you know that this entire situation, first of all, is unnecessary. And secondary, it's very, very frustrating. So how do we answer the question then on who is responsible and what can each one of us do? And when I say each one of us, I'm talking about every single person, from client, principal contractor. If you're in health and safety, we're not saying you don't know what you're doing. We're just saying maybe take a look at more of an initiative to help contractors, because we know and understand that many of them are having the same situation, the same issue. So how do we answer this question? Who is responsible? Well, the main piece of occupational health and safety legislation that we need to address within our organization is the OSH Act. That is the Occupational Health and Safety Act 85 of 1993. And it's very, very simple. It outlines the answer that everyone is responsible. But now you don't like that answer, do you? It's too vague. You want to know exactly, you want to understand exactly what you need to do to execute your role within the Occupational Health and Safety Act. Because it's not just the OSH Act, is it? That's the main piece of legislation. But then there are additional construction regulations, facilities regulations, general safety regulations. We look at SANS standards or codes that impact your scope of work. And when we look at SANS standard, we're not just talking about SANS codes for how to install plumbing or solar geysers. We're looking at it in terms of health and safety as well. If you're using a scaffold, well, then SANS 1885 will affect your construction work or your project, because that scope of work that you're performing has to conform to a standard. So how do you then manage all this information into a simple and effective answer? And not the answer that we gave you earlier, everyone is responsible. I know you're tired of hearing that. You want to know exactly what you are responsible for. So it seems complicated. We have the OSH Act. We have 21 regulations, including the new COVID-19 directives. We've got numerous standards, we've got codes, and on top of that, we receive a health and safety specification from the client, a baseline risk assessment for the project. We then receive a health and safety plan from our principal contractor. And all of these documents with so much wording tells us that we need to have our own health and safety, but nobody really tells us exactly what we need. Now, who is responsible for telling us exactly what we need? Well, fortunately, it's not a person, but it's a document. And it's very, very simple. However, it takes a little bit of time. And this means that you, as an employer, or the employee who is responsible in terms of overall health and safety within the company, needs to sit down and design what we call a legal register. Now, this is the simplest type of document that is going to be able to assist you. To ensure you have everything, first you need to start by listing the type of work you do. And don't be too general when doing this as a practice session with the plumbers. Well, one of the companies that we chose to do a practice session with, we asked them, what is your scope of work? And they just said plumbing. Well, that's too vague as well. Basically, you are answering the question like I answered you earlier. Who is responsible for health and safety? I could just say everyone. That's not really the answer you're looking for, is it? You want more specifics. Well, it's the same as what we would need from you. If we ask you, what is your type of work? You can't just say plumbing, because there's so many various areas within plumbing, various scopes of work. So let's look at all the steps you need to take to complete a specific task or project. Again, how would you do this? Well, you would always start with an input. So step number one is, what is the first thing you need to do to start your project? Now, this could vary. It could be on the job already, or it could be at your office, or it could be with a procurement department. Whatever it is, we just took a look at something very simple. You need to load your tools and equipment into a vehicle and get to the client. So that's very basic. Doesn't matter what you're doing on site, you will always have that first step. You see, whether you're installing a geyser, you will still need to load your tools and equipment into the vehicle and get to the client. Whether you're doing a hydro boil, you would do the same thing. If you're simply going out just for maintenance, you would still need to do the same thing. And so this is where a legal register will assist you. Now, how you start by doing that is by looking at the overall scope of a company and be specific. What do you actually do as a company? Well, you install geysers, you do maintenance on geysers and taps and plumbing and hot water and cold water, you do water reticulation, you do water saving, you do solar power. So mark all of these areas down and then break them up into steps. For instance, when loading your tools, you need to first inspect your tools and equipment. This would now mean that you need to have a register and a checklist, is it not? A register of the tools that you need to take to site and a checklist for each tool that you're going to be using. And these are generally daily, weekly, monthly, or 3 monthly registers and checklists that you would normally have in accordance with what type of tool you use. Generally speaking, if you have any hand tools within a toolbox, these have to be inspected once a month according to your construction regulations. Now, some principal contractors will say that is the minimum requirement, and we'll get to that in a minute. What is minimum requirement? But for you at your company, you want to deal with minimum requirements in terms of the law. That's what you have to do, not only when you are on site, but within your own health and safety program. And this is what we're trying to really express to each business owner out there. This is a requirement for you as a company, not for a site. In other words, you should have a health and safety file for you, your company, not just because your client requested a safety file. All right, but we will discuss that in the next slide as well. The next step within the first step, if we can put it so, the sub-step, is to manually carry tools and equipment to your vehicle. So now that you've inspected it, you now need to carry these to the actual vehicle. And yeah, you can have a little safe working procedure, as you can see in the picture on the right-hand side. Plan your lift, ask for help if you need to, widen the base of support, bend your knees. We know this. Use your back, don't use your legs. Is that right? Well, no, it's use your leg muscles. Keep the load close to you. Don't use your back. Try and keep your back straight so that you do not take stress or strain on your back. This is all part of health and safety, things that you know. And you might think, well, this is too simple. Well, that's really what it is, isn't it? It's common sense. It is simple, but we need to constantly practice it. We need to put it into a risk assessment and say, what is the risk if I haven't inspected my tools? Well, the risk there, or the hazard that you are going to be faced with, is working with damaged tools or working with tools that have not been inspected, that have not been trained on, working with equipment that is incorrect or the wrong tool for the wrong type of work that you are performing. If you do not carry the equipment correctly, you have ergonomic related issues where you can damage your back or strain your muscles, or you could even put too much strain on the body, the neck, the shoulders, or even the actual muscles that you are lifting with as well. And that's why you would need to ask for help. What about driving to site? Yes, with the new COVID regulations, you're going to add in things like ensuring you've sanitized, ensuring you've got your mask. But very importantly, you need to know that the vehicle is roadworthy, that the employee who is driving it has a valid driver's license. You see, all of these steps outline a register of what you are performing, and then it attaches the legal side to it. Now, when it comes to tools and equipment, if we just think of something like a ladder, most plumbers use a ladder. Well, General Safety Regulations Section 13A will automatically assist you. So when you have ladders, you put that piece of legislation next to it, read up about it, put it into your risk assessment, safe working procedure, how to use a ladder safely. Nobody has to tell you that. You see, it's already written in the legislation for you, which means you need to take the time out to find out what legislation says about the types or scope of work you are performing. Now, yes, it is going to be tedious. It's going to take you quite a long time. If you've already designed something, and this is where we are asking for your assistance as a plumber in the industry, IOPSA has commissioned us with trying to design a legal register for the plumbing industry. And this is something that we want to do. But it's very vague. What is plumbing? And so we want to ask you, what are the specific types of work you do within plumbing? Maybe you're a health and safety professional. You don't work in plumbing, but you work with a lot of plumbing contractors. You will be able to see their scope of work from a health and safety perspective. Please get in touch with us. Send us information. If you think that there's something that we're overlooking, your contractors are overlooking, send us that information so that we can make them aware of this type of important information, whether it has to go into a checklist or a register, whether it has to be included in their risk assessment or safety plan, whether we need to design a new document based on that scope of work. We want to assist you. So let's take time. It doesn't mean you have to get this done today or by the end of the week. It's a work in progress. So let's put the first step in place. Let us gather the information. Let us assist you with this. Put it into a document that is understandable. And then we start referencing documents to this. Now we're starting to design a safety management system. What does this actually mean? Well, let us take a look at Section 8 of the Occupational Health and Safety Act. Again, answering the question, who is responsible? Two very important laws here are presented in Section 8, the duty of the employer. And this is the owner of the company, the person who is getting the work in, designing the work, looking at the project that is ahead of them. They might not perform the actual work. Sometimes they do, but sometimes they are in the background running the company. And so they explain to the employees or management what needs to be done. But two very important things come out in this legislation. So Section 8.1 and 8.2 are the two main sections within the law, specifically speaking about Section 8. Now, out of these 11 points that it brings out, it says provide and maintain a working environment that is safe and without risk to the health and safety of his employees. And this includes a safe system of work that protects his employees and others from risks and hazards. Now, this safe maintaining of a working environment or a health and safety system, this really is what we're discussing with this legal register. You see, as you put all your scope of work down, you now have a step-by-step guide on how to input your risk assessment, because each step will have a hazard attached to it, and you will then be able to analyze the risk and measure it or rate it, low, medium, high, or catastrophic, depending on the type of risk assessment you use. The second very important one is providing supervision, instruction, training, and information. Well, see, first, you've designed the system. You attach legislation to it. So what legislation affects you and how does it help you to carry out your task? For instance, appointing a supervisor to manage, putting it in terms of a legal appointment. Now, if it's in the OSH Act, you would use an 8.2E or an 8.2I appointment. If you're appointing them on construction and you're a principal contractor, you're going to use an 8.1. This is a construction site manager, which is generally appointed by a principal contractor. And then he is allowed to appoint an 8.7. Now, 8.7 is a construction site supervisor. generally supervising specific areas. And this is generally, as we use it in the construction industry, for specific contractors. And so the contractor then has his own 8.7, if we can call it that, his own supervisor. Now, all of this is maintained within a legal register, responsibilities, rules, and how to carry it out. And this is all the responsibility, again, answering that question, who is responsible? The employer of the company. Every aspect of occupational health and safety within your company falls under the responsibility of the employer, not the project health and safety, your company's health and safety. So yes, you might have safety files for site, but do you have your own health and safety system at your company that you can pull documentation out of that to create a site-specific safety file? You see, a safety file shouldn't just be designed once off for a site. It should actually come from our main health and safety system, because you should automatically be working safe. So please remember this, as it is vitally important for every company, and it is part of law. You have to provide a working environment that is safe, not just on a project, but within your own company. But let us answer the second part of that question. What about employees? What are they responsible for? Well, again, Section 14, duty of the employee, brings out two very important laws. Number one, an employee must take reasonable care for the health and safety of himself and of others. So that's pretty broad, isn't it? It's not vague. It's telling you that you have to look after your health and safety as well as the health and safety of others. Yes, your company or employer must give you the documentation that you need to abide by. But the second important law is that you must cooperate with that safe system of work, and you must obey the lawful order in terms of health and safety that has been given you. Things like wearing your PPE. If you're working on a roof, ensure that you are hooked up 100%, and we cannot express this enough. You see, it might be written on a document, but it doesn't mean that you are doing it on site. So how does this work? Well, an employer must give you all of the necessary tools in order to work safe, but it is your responsibility to work safe. And then your employer must ensure and enforce that you are doing it. And this is where people start fighting non-conformances and non-compliance, and that's really not where we want to get to. We want to enforce by toolbox talks. We want to enforce by giving you more responsibility that comes with greater benefits at the end of the day. That's actually what your company wants to do. But it always turns out, as we mentioned in the beginning, he said, she said, client is upset and contractor is upset, delays, penalties. And that is really unnecessary, because an employer is responsible 100%. But employees, you are also responsible. In fact, it means that you are responsible to uphold the system that was put in place. So if your safety officer of your company, health and safety manager or employer, gives you a safety file to input on site and uphold, if you do not know what is in that file, you will not be able to uphold it. Correct. So if we don't know what's in the risk assessment, what's in the safe working procedures, or what's in the plan, we won't be able to uphold that. So it's like having a gym contract. You go to Virgin Active, you're paying a monthly fee, but you never go to gym. 6 months down the line, do you have a rock hard, solid body? Well, no. Just because you have a gym contract does not necessarily mean that you are getting fit. You have to put in the work. So when your employer gives you the contract, you now need to go and act on it. So it means that you need to work together, and cooperation is one of the most vitally important things. So let's wrap this up by answering that question again: who is responsible? And one of the questions that came out is, what is minimum requirements? Well, let's look at it in terms of the OSH Act and the construction regulation only. In terms of the construction regulation, a client should issue you with a mandatory 37.2 agreement, that's from the Occupational Health and Safety Act, and a safety specification that you adjust your current system. not create a new one. You see, you should have one already because it's according to law, but you adjust your system to conform to what is written in the safety spec. And that comes from Construction Regulation 5, the duty of the client to provide a safety specification. Now, this is right at the beginning. This is at tender stage, not while you're on site working. This is right when you are tendering for the entire project. A health and safety specification should be designed. So when you are appointed as a principal contractor, you receive a mandatory agreement, you receive a safety specification, and any other vendor documents. Based on this, you as a principal contractor design a safety plan. Then as a contractor, you design a safety plan based on, first of all, the client's specifications, and then reading the principal contractor safety plan and risk assessment to help you design a minimum requirement safety file. Not minimum requirements in terms of only the OSH Act and regulations, but it has to include the minimum requirements of the safety specification. So please understand what we mean when we talk about minimum requirements. If you are outside of a project, it only means the OSH Act and regulations applicable to you. If you are on a project, you need to find out what is required on that site. And this will absolve a lot of issues, especially when you're on site and they say, where's your first aider? You should have had one according to the safety spec. And you say, I don't have more than 10 employees according to General Safety Regulation 3.4. I don't need one. It was written in the specification. It becomes a minimum requirement. But safety professionals, if you did not issue the safety specification at the beginning of the project, how would they know what is minimum requirement? You cannot refer to a piece of law after the fact. So please work together with your contractors. And if you need, send us your specification. Let us assist the plumbers in the industry to design a specialized, specific safety plan for your client or for your site. So thank you very much. We hope we answered that question.